Hi, I'm Dr. Bill Berkowitz of Life Chiropractic. Welcome. Let's talk about anti-inflammatories for arthritis. Are the rewards worth the risk? If you were to go to a doctor and you had high blood pressure, and the doctor said, I can give you this medication that's going to bring your blood pressure down, but it's actually going to make your heart disease worse. Does that make sense? Would you want to do that? So when we're talking about arthritis here, we're talking about two different kinds. They're either called DJD for degenerative joint disease or OA for osteoarthritis. They're the most common form of arthritis. It's the kind of arthritis that you get because of wear and tear. It's the kind of arthritis that leads to a hip replacement or a knee replacement or spinal arthritis. The most common drugs that are prescribed for this or recommended for this, because many of them are over the counter, are called NSAIDs, non-steroidal anti-inflammatory drugs. They knock down the pain, sometimes quite effectively. But I bet you didn't know that they've actually done studies on people taking NSAIDs for arthritis, and guess what? Their arthritis got worse with the use of NSAIDs. So here they are taking a drug recommended by doctors to treat the symptoms of their arthritis. And the medication they're taking to treat the symptoms is actually making the condition worse. If that's not lunacy, please let me know what the definition of lunacy is. Another common drug used are steroids, albeit for a very short duration, but steroids are often used. Now, steroids actually destroy the cartilage in joints over time, and that's really what arthritis is. But even more important than that, there's significant complications. Almost 1 in 10 people taking steroids has a significant complication. So it really doesn't matter. So let's think about arthritis. Why does it develop? For some people, it develops because they've had significant trauma and that joint breaks down faster. But even in the people with trauma, they end up creating an imbalance that causes accelerated wear and tear. Have you ever thought about somebody who has a hip replacement but has one good hip and the other one needed replacing? They have 2 hips. They take just as many steps with each leg. Why did one wear out? Because of imbalance. That's what chiropractic's about. Chiropractic has a focus of trying to bring your body back to a place of balance. If we can bring you back to balance, there's less stress on the joints. There's less stress on the nervous system. There's a slower wear and tear and a avoiding development of arthritis or slowing down the worsening of arthritis. Let me give you an analogy. You drive a car. You want to make sure the front end is aligned and the wheels are balanced. If they are, you get the greatest mileage out of those tires. If the front end is out of alignment and the wheels are not balanced, that set of tires that might give you 40 or 50,000 miles might only give you 15 or 20. Now with tires, you can go get a new set of tires. You can't do that with a spine. You can do that with a hip, but who would want to go under surgery and get a hip replacement? I don't care who you are, your activities are limited once you have a joint replacement. So they've done studies. Chiropractic is incredibly effective at reducing the symptoms of arthritis, increasing the motion of those arthritic joints, and exercise is incredibly effective. Now, exercise is another one of those things. People get arthritis, they get pain, so they pull back on their activity. But what that does is it actually makes things worse. You need to find an exercise that you can do that doesn't aggravate your arthritis. They've done studies on this as well. So really, it's insanity to take drugs that are making the condition for which you're taking them worse. Make sure to subscribe to my social media channels where I update on a regular basis. You can also find great information on my website, lifewithinchiropractic.com. Thanks.